All right, we'll go ahead and get started. Thanks for joining us for the 2019 or 2020 weekly COVID-19 media briefing. Just wanted to let you guys know we do have our final flu shot drive-through event tonight. If you guys are available to do it yourself, or if you want to mention it in any of your articles, that'd be great. I'll post the link to the press release in the chat box. We just have Kevin Dick today, the District Health Officer. So Kevin, if you're ready, please go ahead.
Okay, sorry, I was having trouble getting unmuted. Sorry, folks, only me today, but thanks for joining us for the media availability. I don't have new numbers to report today. We'll be reporting those out later today. The seroprevalence test I wanted to talk about, we're working to have a second round of seroprevalence testing that will be using the State Public Health Lab's antibody testing. And so this is a survey to identify how much spread of COVID-19 we may have occurring in our community to date. So this is similar to a study that we did in June, where we have mailed invitations to randomly selected households so that we have a scientifically designed approach to having people participate to have their antibodies tested to see if they have been infected with COVID-19 and developed antibodies to date. So we are going to be beginning the specimen collection from those individuals this Sunday. We did mail out a second invitation letter to try to get more response. So we're urging if any of our citizens.
Okay, and that's the drive.
I think we've got somebody that's not muted. If you can please mute if you're not speaking. Thank you. So we did mail a second letter to try to encourage additional participation from those households. And so we're urging any of our residents that receive that letter to please call us to sign up to participate. We really need your engagement and it's a free test. And it's one member of each household that will get the antibody test, an adult with the nearest upcoming birthday. And the other members of the household are also invited to be tested for COVID-19. So please participate if you're able to, and it will help us to better understand what may be occurring with COVID-19 in the community. As you'll recall from the results that we had from the June survey, we found that it was approximately 5 times as many cases of COVID-19 were estimated to have occurred in the community as we had detected to date with the testing then. So we want to use this to also update our understanding of what's occurring with that spread in the community. The 7-day rolling average that we have of new cases over the past week has increased significantly. It's currently running at almost 88 new cases per day. Last week it was down toward the mid 50s. So that's a week over week increase of about 50% of new cases per day that we're seeing in Washoe County. So we attribute a number of these cases to people that participated in private gatherings over the Labor Day holiday that are now testing positive for COVID-19. We're also aware of cases that are resulting from students that at UNR that attended the private parties that were going on off campus and were exposed to COVID-19 and are now testing positive for that. So while we're meeting the governor's criteria for all but one category, that one category is the number of new cases that we're experiencing, and we're seeing an increase in those cases. That is of concern, and we should all be aware that there's still a lot of COVID-19 in the community, and we're seeing that People are becoming infected just by being out and about in the course of commerce and encountering other people and being exposed. But also we continue to see that private gatherings are a source of infection for people. And so people should be very cautious and avoid gatherings. If you are participating, outdoors is better. The social distancing, the masks, all of the precautions are remain very important. We, as a nation, have passed a significant and sad milestone of over 200,000 people that have been killed by COVID-19. We are at 154 deaths here in Washoe County. And I think it's important to recognize that each of these is a life lost, and it's families and loved ones that are left behind. And so we have many people in our community and across the nation that are suffering from this loss. And we have also many people that have not fully recovered and continue to suffer from the effects of COVID-19, even though they have gotten better from where they were. So it's a serious disease. It's had significant impacts, and we need to continue to be vigilant in how we're approaching it. So with that, Scott, I'll turn it over for any questions.
All right, thank you, Kevin. If anyone has any questions, feel free to shout them out now. You can also put them in the chat box and I can read them. Go ahead.
Hi, this is Siobhan from the RGJ. Hey, I wanted to follow up on something Julia Peak told the school board last night about the possibility of a vaccine being here in 4 to 6 weeks. Can you talk about that, and have you contracted out with anyone to do that vaccine, and what's the permit process, and what plans do you have in place for a vaccine if it's coming that soon?
Well, we don't know if it's coming that soon or not. We've been told that it may be available along that time frame, but it's certainly not anything that's guaranteed. And I think that's quite an optimistic time frame for actually receiving it. We are working on our vaccination plans. Part of the reason that we're doing the flu pod today and have been doing those is one, because we want to try to make sure people don't get the flu this year with COVID-19 going on as well. But two, to also be brushing up on our processes for providing those mass vaccinations. So we're working on our plans moving forward for being able to deliver the vaccinations. What we anticipate is a limited supply as the vaccine does become available. So we'll be focusing on some priority populations to initially receive that vaccine, and with additional supply coming later as production is ramped up. We'll be working on our own plans for providing the vaccinations. We'll also be working to engage our community providers, our healthcare system, to be providing those vaccinations as the supply ramps up and we have more vaccinations coming through the supply chain.
So you would use those flu spots maybe to roll out? You're seeing how they work as kind of a vaccine for the flu. Is the plan to use those same spots for COVID?
We intend to use our drive-through location that we have for the Reno Livestock Event Center for providing the COVID vaccinations as well.
And then what about this company the CDC has talked about, McKesson? Are they here? Are they trying to get permits here? What does it mean if they have to fast track getting a permit or a license here?
McKesson is a large national supplier. And so we have existing relationship with them to receive vaccine. And so we'll be working with the state and the federal government on the distribution. It's not clear yet whether we will get our vaccine directly delivered to the health district for our utilization, or if it'll come through state channels and then to us.
Have they applied for any kind of special permits or their subsidiaries? I know McKesson's the big company and they have little, probably affiliates or whatever. Have they applied are ready to go through a permitting or licensing process for the vaccine?
They are distributing the vaccine that is being developed by other companies that the U.S. government is contracted with. So I'm not aware that McKesson has to go through any specific permitting process for that.
Okay, so they could just come here and set up. They don't have to
They won't be providing the vaccinations directly. They'll be providing the vaccine to entities like the health district that would be then actually putting the shot in people's arms.
And you said Julia's Peaks is pretty optimistic. What's your guess on what?
Well, I think what Julia Peak was saying is that she's heard through the CDC and the media that it might be 4 to 6 weeks before we get the vaccine. That's also what I've heard. And in my opinion, I think that's fairly optimistic. I think that while it's not beyond the range of possibility, I think that's consistent with what we've heard from Dr. Fauci at the CDC also.
Hey there, Kevin. Brian Hoffman with 2 News. We were hearing rumblings about a possible second reinfection here in Washoe County with a male in his 30s. I was wondering if you were able to confirm that and maybe kind of give us the details, because I know there's a scientific process in determining if it's an actual reinfection.
So I guess I'm not aware of a second reinfection beyond the first one that's been reported out. So I can't comment on that. Maybe I'm behind on getting the information, or maybe that's a rumor. But we were involved, our epidemiology program, with the State Public Health Lab on the testing of the individual who earlier this year did become reinfected, and that person, through the genetics work on the COVID material that was collected during the testing, we were able to determine that it was a different genetic strain of COVID. So that helped to confirm that it was a reinfection that occurred in that individual.
Cool. Good to get to the facts of it. And I did want to talk to you a little bit about the rapid testing that they're kind of rolling out when it comes to the federal government wise. I know that the county isn't necessarily doing the testing, but a couple were sent to local hospitals. Do we know when and if the county will start that rapid testing? I'm talking about the one that is the 15-minute turnaround.
We had a limited number of those rapid test units that were received through FEMA and for the state, and we were directed to deliver those to the facilities that have them. So we don't have any plan right now to be doing the rapid testing here at the health district. We'll continue to do the molecular test with the PCR with the State Public Health Lab and Charles River Labs. But the rapid test units that we received were deployed to Renown Health, St. Mary's, Northern Nevada Medical Center, and the Community Health Alliance. I am aware that Walgreens has also got a unit, and they're running the rapid test at one of their locations here in town.
So 2 little follow-up questions. One, those I just want to confirm too, those tests are being put into the same categories and counted the same way as the other testing. And then how do you feel about these rapid tests? I mean, we're getting figures in, they're only 80 to 90% accurate when compared to the testing that we're doing here in Washoe County, which is around 95%. How do you feel about that, especially since the federal government is spending that $760 million with Abbott Laboratories, and it seems like this is the way that the federal government anyway wants to start aiming testing?
Okay, so let me mention a few things. There's 2 different Abbott tests. And there's the Rapid Now that is the molecular test. And so that's the one that I just mentioned and was talking about. And I think that it's probably closer to around 70% reliable, accurate, according to my understanding. And so it's a good test for people to take for really rapid results, that 15-minute result, to see whether you get a positive or not. If you test positive with that test, then that's a good test result. We don't have problems with false positives from that Abbott ID Now test. The problem is where you may have COVID-19, but you get a negative result back. The problem with that test is there's a higher potential for a false negative. If somebody gets a negative test result from the rapid test, then the recommendation is that they also then go and get the PCR test so that they have a more reliable test result to rule out having COVID-19. But it's a good test. If you get a positive result, you can trust that you do have COVID-19. The other test that's just starting to get rolled out is the Binax, I believe it's called, and that's an antigen test. And so that's intended to be rolled out for detection of people that may have recently been exposed and have developed some antigen as an indicator that they have COVID-19. But that we don't have that in place at this point, and the federal government is ramping up to provide those to our assisted nursing and long-term care facilities.
Do we have any plan to impose those type of testing as standard in Washoe County, or are we going to continue with the type of test that we have now for the foreseeable future?
I believe the approach that the federal government has is to focus on those assisted living facilities initially. So we don't have any plans at this time to move to the antigen test. And our plans moving forward are to continue with the PCR testing that we have available.
Cool. And then one last question for you. I apologize, everyone. Do we know yet if the rally that was held down in Minden caused any type of spread? Have we had any confirmation from people who attended?
I have not heard any confirmation. I think it's a little early to be seeing results from that yet. That occurred about a week or so after the Labor Day holiday, and we're I think right now just seeing the Labor Day impacts that are hitting us.
Thank you, Kevin.
You're welcome.
Hi, this
Thank
is
you.
Hi, this is Lucia Starbuck from KUNR. Kevin, you said our cases per day are no longer meeting the governor's criteria. So what will happen if we continue to not meet that criteria?
So we have not met that criteria since the governor's criteria was first established. The way the state's county tracking system works is they have three different triggers. The first is whether we're achieving over 150 tests per 100,000 people per day, and we are achieving that. The other is whether we're have a positivity rate of our test results that's 7% or less, and we're achieving that. And the last one is the new cases per 100,000 people over a 30-day period. The threshold for that is 200, and we're over 300 for that one. So it's the way the county tracking system is set up. We do not trigger for elevated disease transmission because we're only exceeding one of the criteria and not two of them. But there is the potential that we could be required to take additional actions based on the duration of having those increased cases. And I think the community needs to be aware of that, because while our local risk meter is at yellow and we're not meeting the elevated disease transmission, we are seeing an increase, a surge in new cases that are occurring now. We hope to see that change direction. I'd also add that with the new cases that we're seeing now, we have a new feature that we put on our dashboard, and it's active cases that are by age group active cases by age group per 100,000 population of people that are in that age range. And so what we're seeing right now is since September, we have seen significant increases in the number of active cases per 100,000 in the 10 to 19-year-old population and in the 20 to 29-year-old population. And so I think this is important for the community to understand that we have seen increasing cases, and we have seen in those two age ranges in particular an increase in cases.
Hey, Kevin, just to follow up on that, you said, I know you've talked about the UNR surge, and that would be the older kids, but what about the 10, 11, 12, 13? Is that related to schools opening? And are you concerned still? I mean, I ask this every week. Are you still concerned about the school district being open?
I am still concerned, of course, because I'm the public health officer. I'm supposed to worry about that stuff. The cases that we're seeing, I think, we're seeing the cases occurring that are in students that attend school, but we're also seeing cases occurring in students that are distance learning. So I think it's important to recognize that. I think the good news is if you go to that part of our dashboard, what you'll see is that the cases that are in the 0 to 9-year-old range have remained fairly stable since the schools have reopened. But the idea that children aren't going to get this, I think is wrong. We know that they can. It appears from what we're seeing so far that we're not seeing that increase in the up to 10-year-old group, or the up to 9, but the 10 to 19, we are seeing an increase.
I'll ask another follow-up. The school district last night tabled their COVID conversation, saying we weren't, we're not at high levels, so it wasn't something that they needed to discuss because we're at that moderate range. Do you think it's a conversation the school board should be having at every meeting about COVID?
Well, I think the conversation specifically was around schools remaining open or schools closing. And based on what we're seeing in the schools right now, as far as outbreak type activity across the school district, I don't think that it's necessary to have that conversation this week.
Hey, Kevin, it's Denise with Channel 8. I want to follow up on the false positives. We know that can happen when there's COVID testing. Is this something that we should be concerned about? I mean, is there a percentage that we assume with the testing in Washoe County that we are getting false positives back?
So the PCR test is very reliable on the positivity side, unless there has been a problem with environmental contamination. That is that you have specimens that may have been contaminated with COVID-19, not from the specimen collection, but from some other contamination that occurred to those specimens as they were being collected and going through the testing process. So I think it's rare instances where we would see those types of issues, and I think that in most cases that would be results that would be a number of samples, and that would be raising flags for evaluation.
Kevin, Frank Mullen with the Reno News and Review. The CDC, in putting out that bulletin about aerosol transmission and then quickly withdrawing it, do you have any take on whether or not people should be more concerned about, even though CDC withdrew the bulletin, should be more concerned about indoor areas, dining and bars and so forth, in light of that attention on aerosol transmission at greater distances than 6 feet?
I think that we've known from the beginning that, or very, very close to the beginning anyway, that it's safer to be outdoors than indoors. And I think that that remains the case. As far as the aerosolized transmission, I think it still remains the case that the larger droplets that are not going to travel as far have the most potential for infecting people that are in close contact with others. So I think that the thing to really remember about this is the importance of wearing masks and or facial coverings, and the importance of that 6-foot distancing, and that is going to be the safest and sensible approach for trying to reduce transmission that's occurring. I think that the issue with the smaller aerosols that may be suspended is one where it's a matter of recognizing that you're not at zero risk if you are beyond 6 feet of that infection, but it's still, I think it's a much smaller risk that people would face. And I think that that would be more because of areas that are not ventilated and have the potential for those smaller particles remaining for a longer period. So I think that we really kind of are, I don't know that that changes the message a lot. I think what's really important for people to remember is that 6-foot social distancing, wear a mask, remember that outdoors are safer than indoors, where we do have the indoor environments, being able to have the air exchange there to be able to keep fresh air coming in.
Hey, Kevin, this is Siobhan again. Back to the vaccine. If we are to get a vaccine sometime this year, do you think it'll be hard like it has in the past for Nevada to get as much as is needed? Is there any, efforts in way to make sure Nevada gets its fair share or gets, or would we be at the bottom of the list?
I believe that to some extent, particularly on the early phase of the vaccine distribution, there's going to be some attention paid to areas that have higher levels of transmission that are occurring to target the early delivery of vaccine in those areas. But I don't anticipate that Nevada is going to be getting shortchanged on the amount of vaccine that's made available to us to be able to vaccinate people. Based on our history with low vaccination rates, it is a concern of whether people will actually show up to become vaccinated. I'm hopeful that with all of the attention that's being paid to COVID-19 and the importance of the vaccine for us to return to more of a normal and more open economy, that people will want to step up and become vaccinated as we move forward. And we'll certainly be working on messaging and trying to make it as easy as possible for people to get vaccinated.
So is this one case where our high numbers would be a benefit because we may get more of the vaccine than states that have a low transmission rate?
It could be, depending on how we stack up. Every day it seems like the pattern is shifting around the country as to where we have high levels and lower levels.
Oh, if no one else has, I have one other one. I see the blood drives now will give you the antibodies results. Do you guys get those results too? And what are, if you donate blood, you'll get, it'll tell you if you were exposed to the antibodies. Do you guys get those results, or what are those showing, or are those accurate?
Yeah, we don't receive those results. I believe that they're probably accurate, but I'm not sure exactly what tests that they're running. They're not of value to us as far as the type of data that we need that we collect in the seroprevalence study, because it's not a randomized sampling that's done that provides you with the statistics to be able to extrapolate what the level of antibodies and people that have been exposed in the community are.
Hey, Kevin, this is Haley with News 4. I have a quick question. So the CDC recently released guidance when it comes to Halloween. Has the health district come up with anything that they're going to recommend when it comes to celebrating Halloween or not celebrating?
So I already provided some input. I think it was last week I was asked about this, and I think we'll probably be putting out some more recommendations on this. But I think the bottom line is that we're very much in agreement with the CDC that we think going trick-or-treating door to door is a pretty high-risk activity with the COVID-19 going on and the levels of transmission that we're seeing in our community. And so to the extent that you can help to point people to the CDC guidelines, they do provide some alternative approaches for celebrating Halloween with more emphasis on the activities that can be done in the household with carving pumpkins, decorating the house, to be doing virtual Halloween costume contest sorts of approaches. One thing I think is important for people to understand with the CDC's recommendations is in regarding to Halloween masks, the recommendation that people, one, not use a Halloween mask as a replacement for a facial covering because it's got the hole right where your mouth is and you're not controlling the droplets and aerosols. The other being that it's not a good idea to wear a mask, cloth mask, and then put a Halloween mask over it because now you don't have the whole area of the mask that you can breathe through, and it may cause breathing difficulties if you're constrained under the Halloween mask and have the cloth mask on.
Any other questions for the district health officer? All right. Thank you all for joining us. As always, this is being recorded and will be provided on the COVID-19washoe.com website. If you hover over press, there's an option to choose press conferences, and all of these are loaded up on YouTube. We'll try and get today's up as soon as possible. Thanks for joining us. See you next week.
Thank you.